Well, hello everyone. Today we have Dr. Dana Gibbs with us. She is specialized in autoimmune thyroid disorders, which, as we will discuss, can actually cause a positive ANA as well as other antibodies. So, Dr. Gibbs, thank you so much for coming here and discussing with us thyroid disorder that are autoimmune. So we know from previous studies that a positive ANA is positive in up to 20% of patients with an autoimmune thyroid disorder. Can you tell us what those thyroid disorders can be? So as a rheumatologist, when there is a positive ANA, I always check the TPO antibody and the TGB antibody, which are both for Hashimoto and GravesDisease. But can you tell us a little bit what those are? Like, what are autoimmune thyroiditis, so that people who have a positive ANA, who are wondering if they may have a thyroid disorder, can learn from you? Thank you.
Sure, absolutely. Hi, and it's great to be here. Thank you for having me. So, yes, autoimmune thyroid disease is, to be very, very basic, it's when your immune system erroneously recognizes your thyroid gland as foreign and starts to attack it in various ways. And there are two thyroid disorders that are autoimmune in origin, and one of them is Graves' disease, where the antibodies, they don't damage the thyroid exactly. What they do is that they stimulate a certain receptor in the thyroid gland and cause it to produce excess thyroid hormone that your body doesn't need and is actually quite dangerous. Interestingly, when you're diagnosing Graves' disease and you use the thyroid receptor antibody, the TSH receptor, TRAB, TSH receptor antibody, if you would check the other antibodies, the thyroglobulin antibody tends to also be high in those people. And so there's considerable overlap. And if somebody who has been diagnosed with Hashimoto's disease gets a thyroid receptor antibody, occasionally it'll be like, oh, look, that one's positive too. So not surprising to me then that you would have other autoimmune antibodies like ANA coming in as positive. The interesting thing about Hashimoto's disease, which is the second and actually the more common of the two autoimmune thyroid disorders, is that 15% of people in the US have antibodies that show that they have either had or have those antibodies. It's super, super common. And only about, and this is variable depending on who you talk to, maybe 20% of those people who have those antibodies will actually have symptoms of a damaged thyroid gland, which is what happens in Hashimoto's disease. The immune system recognizing the thyroid gland and tissues as foreign and attacking and causing damage. And that is thought to be a cellular process. It's part of the immune system that is, so the antibodies are the signal, but they're not actually what's causing the most of the damage. So yeah, very interesting, these percentages. And, when I was looking this up, and it was like, okay, so people who actually have Hashimoto's disease, 47% or many of them have ANA positive, and many of them have other autoimmune markers. I was actually kind of shocked about that. So it's not an isolated thing, but it is the most common autoimmune disorder. And so people come in to me all the time and they're like, I have Hashimoto's antibodies. What does it mean? And I'm like, well, it means a couple of things. One is that you have a percentage of chance of having damage to your thyroid gland. But the second thing that it means is that you have an increased percentage chance of developing other autoimmune diseases. And so, there are a lot of thyroid doctors, there are a lot of endocrinologists who treat the thyroid disease is as in the deficiency of thyroid hormone, but they don't look at the fact that somebody has those Hashimoto's antibodies and say, okay, you need to get these under control because your risk of developing these other conditions is quite high. And so I tend to do both of those things, whereas not many doctors do.
Okay, I think that's really interesting. So in rheumatology, in the world of rheumatology, and I often say this, the first thing, and it's usually a positive, like an ANA has been checked because there are some symptoms, and
Correct.
it's kind of like it's a test that very often comes in as part of like, I don't really know what it is, so I'm going to check an ANA. This is
Yes.
some of the
Yes.
things I've noticed. And we know in rheumatologic disorders, that the antibodies in the vast majority of cases come first. And as you mentioned, first there are antibodies, then there is inflammation, and then there is damage. And when you're talking about the Hashimoto, which, I actually make a lot of diagnosis of Hashimoto, not Hashimoto disease, but Hashimoto's antibodies, because a lot of patients come to me with positive ANA, and ultimately they have nothing else, positive TPO, which is the one that's associated with Hashimoto. But it is interesting in the sense of, if it is a rheumatologic disorder, if I were to think that they have early lupus or undifferentiated connective tissue disorder, I may actually offer them plaquenil, which is not immunosuppressive, but rebalances our immune system.
Okay.
Do we know if it has, like, because they ask me, what do you think in Hashimoto? Should we do something to stop the progression into the full-blown disease? Is like, to me, the way I see it, and that's what I tell them, but I tell them that I'm not a specialist in autoimmune thyroid disorder, right?
Right.
To me, I think, well, Hashimoto, the risk in Hashimoto is basically a weaker thyroid, which you can actually help by just giving thyroid hormones. But what is your take on this? And I'm sure I'm sure there are studies going on, but I know that it's not very well researched. But what's your take?
Sure. So my take is that stress and hormone fluctuations and inflammation are all associated with developing Hashimoto's antibodies. And so I tend to start with nutrition and with stress management with people. And the nutrition stuff is, I want to make sure, absolutely sure, that they don't have a vitamin D deficiency, because there is now a lot of evidence that insufficient or low vitamin D levels is a huge risk factor for developing autoimmune diseases. And I'm not completely sure that you can completely I don't think that you can cure an autoimmune disease once you've got the evidence of it, but I do think that there is some downregulation that goes on when you get the nutrition stuff balanced. And so I'm checking vitamin D levels. I'm having people supplement their vitamin D in whatever way works for them. If they want to go and lay out in the sun, that's perfect. If they want to take a supplement, I'm fine with that. I also look at their iodine levels, because you can have too much iodine, which can be a trigger for Hashimoto's disease. And you can have not enough iodine, which is mostly going to cause people to develop a goiter. But I think the more abnormal growth you have in your thyroid gland, the more likelihood is that something's going to go wrong there. And so I'm looking at balancing their iodine levels. I'm looking at the amount of protein that they eat, the amount of sugar that they eat. And I'm encouraging people to stay away from processed foods and take a mineral supplement and take B vitamins. I mean, there's just, there's so much that just has to do with living in the United States and the fact that we just eat junk. We eat convenience food all the time, and it's very, very hard. And when I do that for people, a lot of them will come back and their antibody levels will not go away, but they will subside dramatically. And I do feel like I'm using that then as kind of a non-specific indicator of the likelihood of something developing into a worse autoimmune condition.
This is really helpful. Thank you so much. So, Dr. Gibbs, could you tell us how you approach a patient, and you've started telling us, but how do you approach a patient that has a positiveana that's found to have either Hashimoto or Graves' disease? So you start with definitely doing all of those lifestyle changes, maybe doing like some vitamins. What's next? What are the next steps? And what is a message of hope that you can share with our patients today that may think or may have this?
Sure. So many people, and this you're getting into, this is kind of the pet peeve that I have about Hashimoto's disease and Hashimoto's antibodies. So many people go to their doctor and say, hey, I'm tired, I'm constipated, I have night sweats, I don't sleep well, I am gaining weight, I am depressed, all these symptoms. And the problem with those symptoms is that they're pretty non-specific. And if they go and they have a normal TSH, which is thyroid stimulating hormone, that indicates that their thyroid gland is still keeping up with their body's need for thyroid hormone, they are told, okay, you don't have thyroid disease, go away. It's something else. Go find out what it is. And the problem with that is that, yes, if your TSH is high abnormal, it means that you don't have enough thyroid hormone. If your TSH is low, it means, yes, it's very likely that your thyroid is making too much thyroid hormone. There's some other things you have to check, like for brain tumors and things. But if your TSH is low, it's not a positive thing, and you need to find out why it's that way. But if your TSH is in the middle, most of the docs will stop there and they will not check people's thyroid hormone levels. Especially they will not check, and this is something I just actually spent the weekend reading, all the reasons why most endocrinologists don't think that checking reverse T3 is something that's valuable at all. But I do. I have done a lot of reading of professional journals and studies, and have convinced myself that I really do feel like you can get some value out of the hormone levels and the reverse T3, and figure out, okay, is this person got something else going on? Because if I check my 5 hormone levels and they are spot on perfect, then I know I must look for, do they have sleep apnea? Do they have a positive ANA and something else is going on? Do they have pre-diabetes that's really, something that they really need to get a handle on before it does serious damage to their bodies? So I know where to point them. I know the other 2 most common or 3 most common things. I can say, okay, please stop worrying about your thyroid. This is the most important thing you need to do next. But if they have some imbalances there, if they have a high reverse T3, if their ratio of total T3 to reverse T3 is lower than, say, 8, then I can make some inferences about why that is. And I can point them in the direction, and I can say, I don't think you're getting enough sleep. I know you say you lay in bed for 8 hours, but I don't think you're getting enough sleep. I can also say, if you have no energy right now, and the fact that you have no energy is keeping you from eating healthy and keeping you from exercising, I can make that better while we work on these other things. And that's kind of my philosophy, and how it's different from, say, a practitioner of functional medicine who just wants you to do the diet and the exercise and the 5,000 supplements that they recommend, and is not interested in having you take a physiologic, balanced amount of the right thyroid hormone in order to get your energy back so that you can then turn around and work on your stress and why are you having whatever inflammation, or why are you developing these autoimmune diseases or whatever. So it's a little complex, but it is a stepwise process that I go through with them.
Well, thank you so much. That was extremely helpful. I think with all of this information today, anyone that has a positive ANA that is wondering if they have a thyroid disorder that's autoimmune, has more information and more better ideas of what are the next steps. For anyone listening all the way to the end of this video, I highly recommend you look at the website of Dr. Gibbs as well as our social media. We will put all of this under here, under this video. Don't hesitate to also reach out to her if you want to become one of her patients. And other than that, I'm going to say thank you so much, Dr. Gibbs. And
thank you for having me.
Yeah, and I hope this was very helpful for anyone that has come here to listen and to learn more. Thank you.